he ho, hi ho, he ho, man, I got a heavyweight sister. She's a medical doctor. She went to med school and all that and been doing her thing a long time. And I know her because she's in my movie. Y'all know I got a movie, right? I'm gonna talk about that in a second, but she's a star in my movie. Oh my God. And I stay close to her because I know she know it. She know everybody in around my parts of the country. Now I've seen her in other cities. So I say all that to say, my name is Anthony Brogdon, and you had Strong Inspirations, where we give it to you straight, no chaser. Oh my God, my whole mission in this is to inspire, to educate, and entertain you, my viewers, about this Black history. And she's going to tell us some Black history that y'all going to be amazed and y'all going to be happy to know. And so, but before we do that, I'm going to ask you, watch the movie that my guest is in. She's in this movie, Business in the Black, The Rise of Black Business in America, where we talk about doctors and medical institutions. And that's her segment. And that's what she's going to talk about today. But you can see it in my documentary form. It's so much more. It's 75 minutes long. And it's Business in the Black. You type that in on Amazon, it pops up. It's real good. And then, I got this book that it complements the film. It's got 200 facts. It's really, really good. And it's going to blow your mind. It's going to blow your mind. My book is going to blow your mind. And it's also available on Amazon. It's titled Black Business Book. And both of them go from slavery times to 1960s. I got to stop somewhere. And I stop at the 60s. So, check me out. And if you want to, come straight to me, cut the big man out at Amazon and just go to my website, inspirationsbystrong.com, because everything I do is the word strong. And this sister, she's strong. And oh my God, I'm so happy she come on my channel. Hey, introduce yourself. Tell us a little bit about yourself.
Well, hello. Thank you for inviting me to be on your show. This is an honor and a privilege for me. My name is Dr. Anita Moncrease, and I'm here in Detroit, born and raised here in Detroit, graduated Detroit Northwestern High School, went to Michigan State University undergraduate school, and then Wayne State's Medical School, graduated from Wayne State's Medical School and did my residency in internal medicine and pediatrics, and joined the faculty there and been on the faculty off and on there for many, many years. I went back and got me a master's in public health because I wanted to serve more than just one person at a time. I wanted to serve communities. So I went to Harvard and got my master's in public health. And
hold on. I didn't know you went to Harvard. I know. You must have got good grades off in grade school and all that. You kind of smart.
Well, I tell you this, I was not known for good grades in school. I was known to do what I needed to do to get by. So my whole path to becoming a doctor was not a straight, smooth path. As a matter of fact, I went to Michigan State on a special program. I call myself an affirmative action baby. Okay. A lot of times people assume that because you did affirmative action that you didn't have what it takes. And I just want to be here to testify that affirmative actions was a right that should have been given to us.
Yes.
And because of the lack of opportunity in my family, I didn't really know about studying to go to college. I would study for my parents' sake, not for my sake.
Yeah.
And so when it got time to apply to college, undergraduate schools, I didn't have the grade point average that was necessary. I was a C plus student. Okay, I did what I needed to do. And
You
so,
have excelled since then.
once I figured out what I was supposed to be doing, I started doing it, okay? And not having doctors in your family to tell you how to become a doctor, and this is a plight that most of us had, again, it's because of what we were denied initially. People don't want to pay the bills that they owe us, but they owe us, okay? Yes. And as they started paying the bill that they owe us, I started learning what it was like, what you're supposed to do to be a doctor, like study hard.
Yeah.
You know.
Yeah, now that's a beautiful, and that's really an intro to what we're going to talk about, Black medical field and Black history for doctors. And so I'm just assuming this, that what happened was when they were slaves, there was some guy, some lady that just had a liking for medicine, and maybe learned some tricks or something like that, and then they became the go-to person for the other enslaved folk. Is that how you kind of imagine that went in those days?
Well, I can tell you how it went in those days. Yes. Versus us imagining it. Okay, so I did a study on the history of Black medical schools and departments in the United States, and I got interested in that because I didn't know at one time in this country or another there have been 19 different Black medical schools and departments in the United States. Right now, there's only 4. Howard, Meharry, Morehouse, and Drew. Okay, and Morehouse and Drew have only been around since the 1960s and 1970s. So Howard and Meharry has been graduating most of the Black doctors. So we said, well, where do doctors come from?
Right.
Okay, with people here, they want to put our history beginning with colonial enslavement. Okay, but the history of the world in terms of medicine doesn't begin with colonial slavery. It actually begins in Africa. Sure. Okay, so I like to tell our story from where it really begins. Okay. It begins in Africa. The first known and documented medical schools in this world began in Africa. They have several that were identified in Egypt and some in Ethiopia, medical schools, okay, documented. And then the first documented doctors, ENT, ears, nose, and throat doctors, GI doctors, doctors of the bowel, eye doctors, dentists, they all began and documented in Africa 2,500 years ago. The first documented textbooks are ours, but that was stolen from us when we get to that period of colonial enslavement. Yeah. Animals, people who are inhuman, okay? And that's what happened to us out of our, and I'm painting a rosy picture, but I want you to think about it. We brought public health to the Europeans, okay? They didn't understand that they're supposed to wash their hands and not drink out of the same water that you bathing in and having bowel movements in. They were wondering why they having all these plagues, and the Moors are just living and strong and being intelligent and having universities. So right. They brought us to Europe to teach them public health. We had doctors. Remember now, I'm telling you, for thousands and thousands of years, I got you. Socrates said Imhotep what was his teacher, was where he got his learning from. Yet we do the Hippocratic oath when we graduate from medical school saying do no harm. Its roots is not Greek, its roots is African. Okay. So like anyway, I'm trying to get you to the point where
yeah. Go ahead, sister. Come on. Hey, I ain't stopping you.
Okay. So when we get to colonial enslavement, what we want to understand about medicine in general is there were no medical schools here in the United States before the 1790s. So whites, blacks, nobody could go to medical school in the United States before the 1790s. So how did they learn medicine? They did it through going to either to Europe to the medical schools, and I told you they got their stuff from Africa, okay? Or they did it through apprenticeships. White, black, it didn't matter. That's the way you learn, okay? In 1620, when blacks were first brought over here, there were blacks who were not enslaved, okay? Right. So we had blacks coming over here, for example, Santomi was the first documented African American or black doctor here in the United States. He was documented here to be trained in Holland in the 1600s. He was not enslaved, okay? And he was practicing medicine. When you practice medicine, then you practice on blacks and whites. Okay, so there were Blacks who were trained, who were free practicing medicine in this country. Okay, then you had Blacks who were stolen from their native countries and brought here, and I say countries plural, and brought here, who were doctors in Africa. And when these white people were enslaving us, they didn't ask you, well, are you a doctor? Are you a lawyer? You know, what, are you a pharmacist? No, they just grabbed your Black self and they brought you here, okay? And you couldn't speak their language, so you couldn't say, hey, I'm a doctor, okay? So what would happen is you would have these people with medical knowledge who were enslaved here, and when somebody needed help, and that's where you were coming from, Anthony, they had this knowledge that they could share and help you feel better, okay? Now, slavery was a business. White people lost money when their slaves died or got sick or couldn't work.
Right.
So they figured out that they needed somebody to help keep their slaves healthy. You know, I'll say they came up with their own HMO system, okay? Managed care system. You know, we got to keep these guys healthy. Right. So if they had somebody, a Black who was enslaved who had that knowledge, okay, they would allow that person to work to help keep the rest of the guys healthy. And if they did a good job, every now and then, white people would come to this person too. Okay,
that's how we do.
And the slave owner could charge white people to come to this person, and he could charge people to let this person who had medical knowledge go to their plantations or help take care of their slaves, so he could make money.
Wow.
Right? Now, if this Black person practiced medicine, practiced healthcare without the permission of their slave owner, then they could be punished.
Now let me stop you there, because you're rolling. You on it good. So now, this Black guy, Black lady had some knowledge of medicine. I'm taking you off kilter just a tad, because this is where, at some point, because we not just use instruments or whatever, or some surgical techniques, we use the roots and the plants that we were able to find, and then that helped cure the person of whatever ailments and this illness. Then the white people even use that as an option to get themselves well. And if it didn't work out, they came up with this term voodoo. That's really where I'm going at this.
Okay, voodoo and hoodoo and conjuring.
There you go. Explain that. That's it. Okay. Yeah.
Well, I'm not going to do an excellent job of explaining it, but what I will tell you is this: it's not just taking a medical knowledge that these Black slaves had, but it's also taken in combination from their spirituality, their religious beliefs and cultures, and it's tying those two together into making into coming up with medications and healing ointments. So the concept of voodoo and hoodoo is actually a mixture of taking medicine and taking religion and putting them together. Now, white folks always have to make things that we do negative, okay? Right. So then we put a voodoo and hoodoo into a negative connotations by saying there's evil spirits and so forth associated with. Sometimes you will see what we call the herb doctors. What would happen is Blacks would go out and walk around in the woods and walk, in the fields, and they'd look for the different things that they recognize from home, from Africa, what they used to use to help cure and treat ailments. And they would take these things back and they would use those to help, make teas and ointments or whatever to help with these illnesses. And they would pass this knowledge on. They called those plantation herb doctors.
Okay. I see. That's good. Now, so after that, as we move up the timeline, so to speak, when is it the first recorded Black doctor enslaved in the 1600s, 1700s?
In the 1700s, there are like 6 dentists in this whole country, and one of them is Black, okay? And his name is Peter, and they write him up because he is so good. What Peter is able to do and he treats Blacks and whites. And again, I want you to notice he's free. He treats Blacks and whites, and he has so many patients that he's noted to ride around on his, and he's dark skinned, okay? He's not the one who can pass. He's known to ride around on his horse. And if you flag him down and tell him you got a problem with your teeth, he can reach into his bag, have you open his mouth without dismounting his horse, reach in and pull out that tooth, okay? Conversation about Black doctors and how they become doctors. You have to be, in quote, good moral character, okay? And so like Peter the dentist, he's also a preacher. And when Peter dies and passes on, his son, takes up the business. And I don't know if you guys are familiar with the story of Onesimus, but
never heard of it.
He was an enslaved African who was brought here, and his master, his owner, was the Reverend Mathis Cotton. And he was here during the time of a smallpox outbreak in the early 1700s, okay? And Onesimus, coming from Africa, went to his master and told him that we have a treatment for smallpox in Africa. We take a horn and we put it into one of the pox of somebody who had the infection. Then we take that horn and we stick it up under another person's skin. And if they did get smallpox, it would not be as bad as if they hadn't got that. That's inoculation. That's your first documented vaccine. He told Cotton Mathis, because it was a epidemic and people were dying, tried it out on his own enslaved people and found out they weren't getting smallpox like everybody else. He probably took it himself and then told some other local slaveholders, and they tried it and it worked. They wrote this up in the newspaper in 1721, in Massachusetts Gazette, I think 1721. Then Cotton Mathis was invited over to Europe to talk about his treatment. And he went to Europe and people, belittled him and said, forget it, and so and so. So Cotton Mathis returned, and that was the end of it until a guy named Jennings. And if you Google inoculations for smallpox, this white doctor named Jennings gets the credit.
Let's go up the timeline just a little bit more now as we move up. What's the first Black doctor to go to medical school?
Okay, so
not HBCU, just any medical school.
Well, okay, because HBCUs is way up the chain. Okay, so when we start looking at Blacks getting formally trained here in the United States, I told you in the 1790s before you got your first medical school,
right?
And then by 1810, you had 5 medical schools here in the United States. And by 1820, you had about 26 different medical schools in the United States. None of them would accept Blacks, okay? Didn't matter how smart you were, didn't matter what kind of credentials you had, they were not accepting Blacks. So the first Black who actually went to medical school could not go here in the United States, okay? His name was James McCoon. He ended up going to medical school in Glasgow, Scotland. Okay.
Yeah.
He not only went to medical school there, but he went there. He got his bachelor's degree. I'm thinking is and you can again Google, look it in the book. But I think he got his bachelor's degree in 1835. His master's degree there 1836, and his medical degree in 1837. Okay, so it's 3 years in a row. I may be off by one of my years, but 3 years in a row. Then he returned to the United States. So he was the first African American to get a medical degree. He returned to the United States in New York and he set up his practice. He opened a pharmacy, okay, there. And he's also not only the first African American to get an MD degree in the United States, but he's the first African American to also own a pharmacy here in the United States. And all this is happening in around the 1837, 1838. And then a few years later, in 1847, a gentleman by the name of David Jones Peck out of Pittsburgh, Pennsylvania. His father is Reverend Peck. We won't get off that time. But he's accepted into Rush Medical School in Chicago. And he graduates from Rush Medical School in Chicago in 1847, making him the first African American to graduate from an American medical school. okay?
Ooh.
And all this is preceding the Civil War. And every now and then, because by 1860, there has been 9 medical schools in this country that have accepted Blacks, not necessarily graduated Blacks. For example, in 1850, have you heard of Martin Delaney? Martin Robinson Delaney?
No.
Okay, so Martin Robinson Delaney, he's actually grown up in Virginia. His mother fled there. His mother was free. His father was enslaved. His mother wanted to teach him and his siblings how to read and write. So they fled from Virginia to Pennsylvania. And in Pennsylvania, Martin Delaney learned as much as he could from his mother and ended up traveling to Pittsburgh so that he could continue his education. There is where he met David Jones Peck's father, Reverend Peck, that I had mentioned earlier.
Yeah.
So he's there learning all this good information. And finally, he learned that they opened a school at the church that the Pecks are at. And he learns as much as he can. And he wants to go into medicine, so he does an apprenticeship. Remember I told you medical schools and apprenticeships. So he does an apprenticeship, he becomes a doctor that way. But he wants a medical degree like David Jones Peck, okay? So he applies to Harvard, and the dean at Harvard's medical school is Oliver Wendell Holmes, okay? He applies to Harvard's medical school, and that year, Holmes has accepted 2 African Americans for the first time in Harvard's medical school history. And this is 1850. He accepts these 2 because the American Missionary Association, I think that's who it is, maybe the Methodist Association, but it's a religious association, has said, you know, if you can train these 2 Black doctors, they'll go back to Africa, to Liberia, and practice, okay? And so he's agreed to accept these 2 Blacks. So Delaney is accepted into Harvard with these other 2 Black doctors, and Harvard's first female applicant was accepted in 1850.
Yeah, I like it. That's what we do. So now, as we keep going up the timeline a little bit, how they accepted in those years, how were they?
And they got kicked out because they were setting the curve.
Yeah, that's what you were saying. So then, when does the Black colleges come on board?
Well, they don't come on board until after the Civil War.
Right.
So you get the formation of the Freedmen's Bureau,
Right.
And the first commissioner is Howard Oliver O. Howard.
Yeah.
Okay, and he's charged with addressing these conditions.
Right.
So one of the conditions he wants to do is help educate them, and so he is supportive of starting. He didn't want to call Howard, but that's what it was called, Howard, in 1867. The very next year, he's convinced that he needs to do something about medicine and law and so forth. You know, more than just the basics, teaching people their ABCs.
Right.
Okay. So he opens the medical school at Howard in 1868. So Howard is the first medical school in the United States that's open not for Blacks, okay, but it's open does not have an exclusion policy for Blacks. Okay, people think that Howard is the first Black medical school. Well, yes, it is, from the standpoint that it's open to Blacks. The first Black medical school that was solely for Blacks was Meharry. And Meharry doesn't open until 1876, and it opens as the 4th Black medical school that opens, okay?
Let's go to this question. So you say there were four medical schools. There was Howard, and then came Meharry.
Right. No, Howard is the first one to open, and you have to think about the mentality.
Right.
You know, why Howard? Okay, well, you got General Howard, and you got all the soldiers and stuff stationed in Washington, D.C. So it's easy and to protect a school in Washington, D.C.
Right.
Number one. Number two, General Howard is over the Freedmen's Commission, so
right.
He has resources, money that he can invest.
Right.
So that's the reason why you open it in Washington, D.C.
I got you.
Lincoln is the second place where a Black medical school was open in this country.
Really? Okay. Lincoln. Okay.
Lincoln.
Yeah, Lincoln.
Right. So you said it, but I like to say, well, there's no magic. Okay. There's no magic. It's common sense. That was the only place that could open. It opened in 1870, 2 years after Howard opened.
Okay.
And General Howard is on the board of trustees of Lincoln, and he
Oh,
promises to give Lincoln money, if they open. And the people from Lincoln help the people at Howard University figure out how to set up and how to run. So it's like a partnership.
I got
Okay?
you. Let me ask you this. What do you think, who were the professors at these HBCUs that were at these medical schools? They were all white people?
Well, let's talk about Howard. Now, I'm going to say this. The first 8 medical schools for Blacks that opened in this country were opened by white people. Okay? They were open in relationship to some type of religion. The Methodists are the ones who other than Howard, the Methodists are the ones who, for example, who open, and Presbyterians who opened Lincoln. So let's get back to Howard. So now, before the Civil War, Howard, has a hospital. Okay, the Freedmen's Hospital is there. Okay, and during the Civil War, remember, initially, Blacks were not allowed to be soldiers in the Civil War. Okay, so about 1863, and I mentioned Delaney one more time. Delaney was out there protesting and soliciting to President Lincoln to allow Blacks to join, okay, the Army, okay, the Union Army. So he finally lets Blacks join the Union Army, and Delaney becomes one of the most highly ranked ones in the Union Army, but he's not ranked as a doctor. And when you see pictures of Delaney, you'll see him wearing a red sash, okay? A green sash symbolizes medicine in the United States Army, not a red sash. So even though he's highly ranked, he doesn't get that. But because he's out there protesting and the doors being open, there are something like 11 or 12 African-American physicians who actually become officers in the Army. They become surgeons in the Army. One of them is Alexander, but he becomes highly ranked and very successful in the Union Army. And he is he gets the rank of almost a major. And because he has that rank, a lot of white doctors have a lower rank than he does. And the white doctors don't want to have to salute him or serve up under him. So they go directly to President Lincoln. They have a meeting with President Lincoln and say they don't want to be under this Black doctor, okay? So Lincoln, solves the problem. He transfers Dr.
Delaney?
No, Turner.
Okay.
Alex, he transfers him to Freedmen's Hospital, okay, where he won't be over any white doctors. So he becomes in charge of Freedmen's Hospital. And when Howard University starts his medical department, okay, its medical department they want to have associated with Freedmen's Hospital. So they make Dr. Turner part of their faculty. Okay, so he becomes, all the faculty is white except for him. So he becomes the first African-American on faculty of any medical school in the country. So you do have that one Black. And then the following year, another doctor, Charles Purvis, they allow him to join the faculty of Howard Hospital. So now you have 2 African-Americans on the faculty of Howard Hospital.
I got you. Now, I talked to a guy a little while ago. He said that he didn't have to finish college to go to medical school back then.
Correct.
I think he went maybe to the 11th grade and then took the exam or something. Is that right? How's that work?
Correct. Let me just say this first. It's Dr. Alexander Thomas Augusta is who I'm talking about. Dr. Alexander Thomas Augusta is the gentleman who rises in the ranks and becomes the first African-American faculty member.
Okay.
Alexander Thomas Augusta.
Now,
yes. So I'm gonna have to fast forward to answer that question.
Yeah.
Okay. So we start seeing these medical schools forming, and in this country, Black and white, you see this big influx of the beginnings of medical schools. They call it the golden age of medical schools. Nobody, Black, white, There are no standards for medical education, okay? What there is you have to do a 2 to 3 year apprenticeship, like Dr. Delaney did to be a doctor, but to get your MD degree, you have to go to medical school. In order to go to medical school, there are no standards. So you can go to medical school without a high school diploma. You can go to medical school going to college for a year. You can go to medical school, because you feel like it, okay?
Wow.
So they came up with, well, at least let us pass a test. I'll give you a test, okay? And so some of the medical schools came up with entry exams. But the main thing that all the medical schools said, you had to have good moral character. Well, there's this organization called the American Medical Association, okay? It's still around today. It's the largest organization of doctors in the country. They apologized in the 2000s for their treatment of Blacks, okay? They apologized, okay? If I can tell you part of their story is the American Medical Association made this rule that, number one, anybody can join us. We're not saying that we're going to exclude anybody based on color. But you have to be a member of your local medical society. Well, most local medical societies in the North and in the South did not accept Blacks. So just by making that rule, they excluded us. Okay. Number two, if you were included in any of their publications or any of their organizations, you were listed as colored. So it was known that you were not Black. So if you were going to apply for anything, it was clear that you were Black. And if somebody had a problem, which most people did, hiring Blacks, you didn't get the job. Okay. And so we moved through this. And in 1908, the American Medical Association starts with one of their committees, Continuing Medical Education Committee. They want to bring the standards up so that everybody would at least have to graduate from high school to go to medical school. Okay, and really, now you have to graduate from a 4-year college. Okay, this is the racist organization that's doing this. Okay, so the AMA goes to the Carnegie Foundation and says, look, we want to put some type of standards here for medical education. We want you to do a study on what schools are doing and then see what we need to do. The Carnegie Foundation thought this was an excellent idea, just like you did. Okay. And they hired a guy by the name of Abraham Flexner to do this work, okay? Now, Flexner had written a report on the status of American universities. That's all he had done. He was not a doctor, okay? And Flexner did his undergraduate work at Johns Hopkins. But Flexner's brother was also best friends of the president of the Carnegie Foundation. People don't know that, okay? So when Pritchard hired his best friend's brother to do this, he hired Flexner to go around to every single medical school and college in the United States and Canada and evaluate them. There was about 150 of them and see, what they were doing and then come up with recommendations. Flexner, number one, didn't go. I think that he did not go to all 150. Okay, so and what Pritchard, the president of the Carnegie Foundation, did not know was that the American Medical Association had the hidden agenda of closing any medical school in the country that was not an allopathic school. So we had different types of medical schools in the country. Like right now we have osteopathic and allopathic. They had electric medical schools that teach you about electricity. I don't know because they're all closed. That they had homeopathic medical schools. They had several different types. The AMA's job was to close everything that was not allopathic. So when Flexner visited these schools, and that included, he was supposed to visit some of the Black schools too, okay? He's supposed to done this over a year and wrote this report. Now, when I was doing my research, and I'm gonna take this moment to be, I don't know, this is a book that we came out with, The Legacy of Black Medical Schools and Departments in the United States. It was me and my nephews and my grandnephews. We went around and my niece to the sites of these 19 different medical schools and departments, really the 17. And as we were driving, we were only going to the ones on this side of the Mississippi, okay? And my nephew was driving one day and he's 16 years old. And he asked me, he said, how could Flexner have went to 150 medical schools in a year And we can't go to, to these,
No,
16, 17
sure.
in a month. Okay, we can't do that in a month. And we got a car, and he's got horses and trailers.
Yeah, right.
So that took us to the Library of Congress, where my nephew was too young to go into the reading room, okay? That I had to go into the reading room. The way we were doing things, where we were doing it together and we're verifying each other's results. We couldn't do that at the Library of Congress. Only I could go in. I asked for Flexner's papers and files, and they would bring them to me, and I would look through these files, and it'd have the name of the school, and there would be nothing in it.
I got you.
Okay. So he's writing these reports on Blacks and whites medical schools, and he's closing them. Okay. He's saying that, I call it medical schools closed for the 4 F's: a lack of finance, a lack of faculty, a lack of facility, and Flexner.
Okay. Oh man. Okay. Let me ask you this question as we move along here for timing and what have you. When does the National Medical Association get founded? The Black Doctors Association?
Yep, I think that's 1892. But let me just say this thing about Flexner. By 1912, at the time he wrote his report, there were 7 Black medical schools open and operating in this country. When he wrote his report, by 1912, only 2 were left open. He closed 5 with his report. And the only 2 that were left open were Howard and Meharry. And he left Howard open because Howard was government. They had guaranteed money to get there, okay? Meharry had an endowment by the Meharry brothers, and so they had some guaranteed money. But his report recommended in 1910 that nobody give any more money to any Black medical schools because they were graduating inferior doctors. Okay. Now these doctors, and we didn't talk about this, but I mentioned 8 of the first medical schools were open were owned and operated by different white churches. The rest of them become owned and operated by Blacks, okay? For example, the Louisville National Medical College is the first one that's owned and operated by Blacks, and it opens in 1888, okay? And his graduate's father is a freedom seeker. He ran from Virginia to Canada, okay? And that's where Fitz Butler was born in, okay? And other Black owned and operated medical schools in this country were actually owned by ex-slaves, people who had been enslaved, or by children of ex-slaves. And when you think about these people, not only had to educate themselves, okay, but now they're able to establish medical schools and teach Black doctors. And then you have to take the same board exam that the white people are taking. They don't give you an affirmative.
So there was an exam during that time.
There was an exam before the Flexner report. Everybody had, different levels. You could train people however you wanted to, it got to the point where you had to go to medical school 2 years. How you got there is one thing, but once you got there, you had to go to medical school for 2 years. The first medical school in this country to go to a 4-year medical plan was, oh my goodness, at Shaw. Leonard Medical School at Shaw, okay, in Raleigh, North Carolina, okay, a black school, okay. Yet when Flexner put his report out, he closed it, okay. He said he wanted them to use the John Hopkins model of medical education because he had went to John Hopkins. But guess what? The John Hopkins model was based on the 4-year model that they had at Leonard.
Wow.
Okay. When he closed Louisville National Medical College. Flexner was born in Louisville, okay? And when he visited Louisville National Medical College, they thought they were going to get a good review, not because Flexner was born there, because Flexner said that they had one of the cleanest clinics, hospitals that he had visited, okay? Now, all schools, had financial problems, white or Black,
yeah.
But they had faculty, they had facility, and then there was Flexner. When the report came out, he recommended that they close. He closed everybody that was Black, okay? And so you only have Howard and Meharry being open from 1923 until 1968 when Drew opens, okay? But that's a problem because Flexner goes even further, and this tells you the level of racism. He goes even further and says, those 2 schools that stay open, white doctors, you don't have to worry about them, taking your patients. these doctors taking your patients. We will only train them in hygiene, how to keep yourself clean, and how to control disease, or how to control disease. The only reason why we're going to do that is because if we don't, the diseases in these Black people can seep over into our community.
Okay, I got one more question because we coming to an end here, so to speak. I know no way we can cover everybody. Since I told you she know what she's talking about. There's no way we can cover it all. One more question. So at the end of these Black doctors, when is the height of the Black medical profession? Is there, some time periods? I know, in the 70s, there was an influx of Black students who wanted to become doctors. Is that the case? Is there some year that we can talk about?
Well, I don't know if there's some year. We can talk about, some periods. We can talk about with the closing of these Black medical schools, you saw a drop in the number of Black doctors being trained. 80% of the doctors who were being trained in this country came out of Howard and Meharry, and now they're being trained not in specialties, not until the 1940s when something else happens. Okay, so you get doctors who are being trained to be inferior. Okay, and then with affirmative actions, you get the door being cracked open, for opportunity for Blacks to attend the white medical schools. You didn't get your first Black to go to a medical school south of the Mason-Dixon line until about 1943, 1944. She didn't graduate till like 1948. Her name S.B. Jones. Okay, she came out of Arkansas then. So you got all these periods where Blacks were not allowed, and that's why it just frustrates me to no end when I hear Black people say stupid stuff like you got to pull yourself up by your bootstraps. Shoot, we didn't have boots. You know what I mean?
And so from that point, and this, I know this is your specialty, and we're going to do another one with you at a later date if you don't mind. But then there's a plethora of Black hospitals.
Yes, and it's the same thing. Blacks were denied as patients to be admitted to hospitals, white hospitals. Some would, but most would not. But Blacks were not allowed to practice. If you had a sick patient, you couldn't put them in the hospital. You could not have Black privilege. You could not have privileges because you're Black. And then Blacks were not allowed to train. See, once you finish medical school, I'll use me for example. I finished medical school in 1984. If I'm not allowed to do any additional training. So this is 2021. You're going to still come to me with my 1984 training, all those new medications and technology. So you have to be allowed to continue. But Blacks were denied that. And so Blacks had to open their own in order for them to not only treat patients, but in order for them to continue to learn. And I want to mention just Miles V. Link. He was a Black doctor. He had been born into slavery. He ended up educating himself in medicine and law and some other stuff. I think he was a minister also. He ended up opening his own publishing house. He ended up opening his own medical school. And his was one who fought off the Fletcher Report till 1923. He was the one, and you mentioned the NMA, he was the one who said, we need a national organization. He was the architect of the NMA. He was not on the original leadership, board president, vice president, stuff like that, but he was the one who orchestrated that and brought it together. He also was the one who wrote the first Black medical journal because Blacks weren't allowed to publish in the white journal.
Wow. Okay? So hey, everybody, we're going to stop her there because I know she got she got a ton of stuff to do, but we're going to stop her there and we're going to digest this. This is what we do as Strong Inspirations. I find these people that know what they're talking about, and you can tell they're passionate. She's passionate about this. This is what she do for. I mean, I've seen her on the road at conferences and stuff talking about the history of Black medical doctors. I know there's a book coming soon.
Yep. There's
a book coming soon, everybody. We're gonna get it. We're gonna make her write a book so she can put this information out. I thank you for watching, and I thank you for being a part of Strong Inspirations. I'm gonna come back at you again because we got more to tell everybody. And but I thank you for doing that. I thank you everybody for watching this on the channel. I'm lost for words. I learned a lot today, and she got more to tell. And these brothers and sisters, they strong people. That's the catch. They resilient. They got tenacity, and so on and so forth. So everybody, I tell you, please subscribe. It's free. Please like this video. It's free. Please tell somebody about Strong Inspirations. I really appreciate it. And to you, Doctor, I say thank you so very much for being on the show. I ask and I pray that you stay strong, you stay safe, you stay on your grind, because we know you're doing this thing. This is your calling to us. And we're gonna say goodbye for now, but we will be back. Thank you. Bye-bye.
Bye-bye.